Alarm noise is one of the most challenging issues in every hospital. Depending upon the acuity of the unit, nurses can receive 350 to 800 alarms per patient per day, 90% of which do not require intervention. All this noise leads to alarm fatigue, missed alarms, and ultimately adverse events and death. In fact, in 2014, the Joint Commission reported 98 alarm-related events, 80 of which resulted in death. To reverse this epidemic, the Commission has outlined steps a hospital must take to reduce the harm associated with alarms. Those steps are documented in the 2014 and 2016 National Patient Safety Goals. However, meeting these goals is a real challenge for hospitals. Data is not easy to come by, evidence-based guidelines on alarms is scarce, there is no one-size-fits-all solution for every unit, and changing behavior is an uphill battle. Not to mention, who at the hospital has time to manage the process? Biomeds are front and center in that management. Why? Because they manage the devices, so shouldn't they manage the alarms coming out of them? Seems logical, but where do they start? And how do they manage such a complex process in addition to their day job? Alarm management solutions are there to help. However, most don't provide all the help a biomed needs. Many do not provide all the data needed, especially data coming from non-network devices such as vents. Most cannot handle high-fidelity data such as waveforms, and many solutions require management of multiple interfaces to get the data needed. But even if a solution solves most of these challenges, there is still the problem of how to arrange and manage the data to make sense of it so you can go beyond just setting the top 10 unit limits to figuring out where the alarm noise is actually coming from. The good news, there is now a solution to address all of these issues. Introducing SickBay, an all-in-one, FDA-cleared software solution for patient-centric alarm management. This vendor-neutral solution features a patented data transformation engine that gives biomeds access to all the data they need from any device, anywhere in the hospital, and access through one central point of integration. SickBay also features a web-based interface that delivers the analytics biomeds need to reduce the alarm noise at the source, at the unit, bed, and patient level. After all, you can't really reduce alarm noise unless you do it on a patient-by-patient basis. Download the Texas Children's webinar replay now to see how they use SickBay to meet their national patient safety goals and reduce time in alarm flood by 50% and alarm noise by an additional 45%, allowing nursing staff to spend time on clinically relevant alarms for improved care and outcomes.